Hi, my name is Nan Rodriguez, and I work with the Fire and Life Safety Education area of the Mesa Fire and Medical Department. And today we're going to talk a little bit about the using of AED machines. AED machines are, the purpose of them is to deliver a current through the heart to try to get the heart back to a normal rhythm. In the case of a sudden cardiac arrest, what happens is the heart goes into a bit of a quiver. It's not functioning properly, and what we're trying to do is to get that heart shocked back to a point where the control is back at a normal systematic level for the heart. What we're going to do then is basically when we come upon a situation where we think we've come into somebody that's gone into sudden cardiac arrest, the first thing that we want to do is make sure that the scene is safe. The scene appears to be safe. We're going to approach, make sure that the person is actually not responding and that there is no normal breathing. Any gasping is not considered normal breathing. So we've determined that they've appeared to have gone into cardiac arrest. So what we're going to do is first of all call 911. 911 dispatchers are trained to walk you through just about any emergency you can come across. So 911 activation is first and foremost important. Then what we want to do is hopefully we have somebody with us and we can send them to get an AED machine. So what we've done, okay, so we've come across this person. We think that they've gone into sudden cardiac arrest. We've sent somebody to get the AED machine and we've called 911. And what we're going to do is start with chest compressions. And we're going to go deep enough, about 2 inches deep, going 100 beats per minute. And we're going to continue to do this until hopefully our AED machine has arrived and we've turned on the machine and we're following instructions. So what we want to do is just a quick prep for the victim that's gone through sudden cardiac arrest to get them ready for an AED machine is we want the area clear, because what we're going to do is we're going to place pads on them so that it can deliver that current through the heart. So we don't want anything obstructing in between the skin and the pads. So what we want to do is make sure that all clothing is taken off. That includes bras for women. All clothing has been removed. If the patient has any type of wetness, if they've been sweating or they're near water, make sure that they're away from the water and you've completely dried off the chest as much as you possibly can. If they have a medical patch, remove the medical patch. Also wipe down that area so it doesn't interfere with the pads. In addition to, if you come across somebody that tends to have a lot of hair on the chest, if you have a razor available, you're going to want to shave the chest in the area where it indicates that the pads are going to go. This whole time we've continued chest compressions. We haven't stopped, and we're just going to wait and do whatever the machine tells us to do. So first and foremost, what we need to do is turn the machine on. Inside the machine, we have 2 sets of pads. These pads are meant for an adult, and it'll show you the exact placement of each one of the pads, okay? These right here are for infants and children. So it'll show you the placement, proper placement for both a child and an infant on these. So we have an adult here that has gone into sudden cardiac arrest. So these are the pads we're looking to use. And again, we've cleared the areas where they've indicated that the pads are going to go. If somebody has an internal defibrillator, what we're going to want to do is just move about an inch or 2 down below that. Normally those are on the left-hand side though, and what we're going to do is place the pads here and here normally. So we've made sure that the area is clear so that the pads can be adhered directly to the chest. Now what we're going to do is we're just going to turn the machine on, and it's going to tell us what to do from now on.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light. Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button. Shock delivered. Paused. Begin CPR.
Okay, so what you see is we've done exactly what the machine has told us to do. All we need to do is turn on the machine, place the pads exactly like they're shown on the directions here, and just follow the instructions of the machine. And we haven't stopped chest compressions until the machine has told us to do so, and then we continue them again when the machine has told us to continue. The same would apply for children and infants. We would take the pads out Apply them as they're shown here. So this one on the infant goes in the front, and this one goes on the back. All other steps would remain the same though. We would just plug this in to the machine and it would tell us what to do. So the steps are basically the same. And if you have any questions about today's presentation, please give us a note on Facebook. And we hope you've enjoyed today's presentation, but in any case, we have classes you can sign up for. If you go to mesaaz.gov and put CPR or Lifesaver in the search, it'll give you a list of upcoming classes.